So today we're going to talk about 5 exercises that are going to help with lateral hip pain. Typically when you get pain on the outside of the leg, there's a lot of things that can happen. There could be a lot of tightness, there can be weakness, and that's what we're going to be addressing today. We're going to give you 2 stretches that really work this area wherever you're tight. So a lot of times if people feel tight down a little bit lower in their leg, they're going to feel some of the stretches lower in the leg. If they feel tight up in the hip, they're going to, wherever they're tight, they're going to feel the stretch. So we're going to show 2 stretches, and then we're going to get into 3 strengthening exercises that can work on strengthening the muscles around this so that this muscle will not take over on everything. So my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting their life back. We help put the pieces of the puzzle together that oftentimes where they're going to 4, 5, 6, 7 different types of healthcare providers without getting results until they come into our office. So that's really what our specialty is. We always say where the side of the pain is often not where the source of the problem is coming from, and we're going to show some pieces of that today. So when people get this lateral hip pain, again, there's a lot of reasons why. There can be tightness, there can be weakness, they can shift their weight over, where they're always using this lateral part of it. But we're going to go into some 2 stretches that you can do that work really, really well. The first one is one of my favorite stretches. It's a game changer. And what we're going to do is you're going to want to be close to something. And you're going to take the leg that's closest, so the leg that's closest to the table is going to come out in front. This is the leg that we're actually stretching. And we want to make sure that knee stays straight the whole time, because if it bends, you won't feel it. You have to keep that knee straight. Then you're going to bend, you're going to keep the back straight, and you're going to bend at your hips until you get a good hamstring stretch in the back of that leg. So when you feel the hamstring stretch, you're going to stop there. And then you're going to rotate towards the table. Now, a lot of times I like to put my hand on my knee because it wants to bend a little bit because it'll be tight, but you want to keep it straight as you rotate forward. Now, ways that you can make it harder if you're not feeling it is you can shift your weight forward on that leg, and that'll make you feel a little bit more, or you can go farther down into the stretch and then rotate to get it. So the farther down I go, the more stretch I'm going to feel. The more I come forward, the more stretch that I'm going to feel. And this is a great one because it really stretches that IT band, but it does more myofascial stretching. So any of the fascia components that kind of get stuck, it's going to release all of that. You'll feel it all the way down the outside of your leg. It is possible. So if you're tight, that's what's going to happen. Not a big deal. So you want to start out doing something like that, holding it for a good minute, breathing through it, just relaxing. The reason why I like having a table here is because you don't have to worry about the balance component, because if you start balancing, then you can't relax into the stretch. We really want you to relax into the stretch, but it's a fantastic one. It works really, really well. The next stretch that we're going to do, I love this one because it's kind of like a standing figure 4 is what I call it. So you'll bring your leg up. And a lot of times their leg will be like this. It won't even come down to the table. So if it's like this, that's okay. Just kind of stretch through it. But if you have a little bit more flexibility, it works great. You can start rotating your body as you rotate out. A lot of times when you rotate away, pushing the knee down, you're going to feel a really good stretch on the outside of that hip. Works really, really well. If you are super tight, then just hang out here. You still will feel a stretch if it's high up. If you just kind of rotate this direction, you may feel it a little bit here. But just let gravity kind of bring that leg down. And again, you're going to want to do this holding it for a good minute and doing it 2 to 3 times a day to really just open up that hip flexibility and tightness that you may have. So those are 2 really, really good stretches when you're having pain on the outside of the hip. It's going to make everything through there feel so much better. You will feel lighter with those. So now that we've stretched everything, we want to go into some strengthening exercises. And so a lot of times people will give clamshells. You probably have seen these a lot, especially on YouTube. I'm going to give you some variations of clamshells. Clamshell works great because the position that you get put in doesn't allow you to really contract the outside part of this hip. it will get more into those lateral like hip rotators, which is fantastic. That's what we want. So on this one, I love this one because you'll get a little bit of hip extension involved, which is great. And what you're going to want to do is you want to get to the point where you're 90 degrees and 90 degrees. Now, this top leg, you're going to, the reason you want to get some books or something to put so that this leg will basically lie pretty, when I push into the wall, it's going to be at a good level. I don't want to push into the wall where my foot's like down lower than this. You want to be up here where it's kind of in line with that hip. So what you're going to do, again, you're going to tuck the hip just a little bit. You don't have to force it really far forward. It's just a small tuck. Then you're going to push the heel into the wall. So now we're getting those hip extensors starting to fire. Really small muscles. So once you feel that, then you're going to bring the knee forward and then come up. You're going to feel this on the outside. A lot of times you may not feel it initially because these muscles probably haven't worked in a while. So a lot of times what I like to tell my clients is to hold the position, and you're going to feel a slow burn through there, which is great. Hold it about 5 seconds, 10 seconds, relax, and then start all over again. Again, you want to tuck, push the heel into the wall, make that knee come forward and up. And when you do that, you're going to really, again, feel it on the outside lower part of those hips. You won't use the muscles up and through here. Holding it again, 5-10 seconds, and I would do anywhere between 15 to 20 of those. Really, really, really good exercise. So the next one that we'll do is another version of a clamshell, and this really works on the hip rotators in different ways, internal rotation and external rotation. So again, I like to be in the clamshell, and you'll do knee to knee, and then you'll rotate and do heel to heel. Now, what I don't want to see is the body, is your upper body moving, that you're getting the back. You're only moving the hip within the hip joint. So I'm not moving this part of my body at all. And you're really getting those deep hip rotators, internal rotation and external rotation as we do this. It's a great exercise. You'll really feel it deep, low in the hip where we need things to kind of fire. Again, I would do about 20 of these. So that would be like each one, and that would be 2 type things, and get up to 20. Again, 1 to 2 times a day is going to work really, really well, but a great exercise that's going to work on gaining some of that strength. Now, I want to show you one exercise that's going to be a little bit more functional. And what these are is you're going to use, like if you have hardwood floors, you're going to use a towel. Towel works great. A paper towel also works great. If you have carpet, a furniture slider is going to work great, or a paper plate will work great over carpet. And so this is going to be on the ground, and your back foot is going to be on this. So what you'll do is you're going to be in that lunge position. So you want to keep the knee bent, you want to stay through here, and then you're just sliding forward and backwards. So all the weight's on the leg that's bent, you're not moving it. So we can go straight back, but we also can go to the inside where we slide the leg to the inside. That's going to get a little bit more of that outer hip. This is going to get a little bit more of the quad and the back part of the hip. So again, if you slide it, I would probably say slide maybe like 10 times and do 3 or 4 sets where you're down in the lunge position, sliding 10 times, come back up, rest, and doing that 5 to 10 times. You can go straight back, or from the leg, you can go to the inside of that leg, and you'll get that a little bit more on the outside. So those are the 5 exercises. Do these exercises and you'll notice a big difference in improving your lateral hip pain. Again, if there's other issues, we always say you've got to look at mobility first, which is how do the joints move. If any of these areas where the joint doesn't move very well, that's going to be a problem, and these exercises may not work. So if you're noticing that you're still having some issues with your hip pain, there's something else that's going on, make sure you get into a healthcare provider that understands how the body works so that they can really pinpoint on what's going on with you. If you like our content, make sure you like, subscribe. We put out content all the time, just trying to educate people on how their body works and how everything really is connected and helping you get back to feeling great no matter what your age.